So the reason I'm participating in the Safe Care Collaborative is because I was one of the senior leaders on the senior leadership programme earlier in the year, and we were also involved in the site visits that Improvement Cymru and IHI came out to all the health boards and did. And what those two things were really timely. They really helped us as a health board because we're in the process of, we've got 5 quality priorities that we're driving forward, and we're also developing our quality strategy and our quality management system. So I found those experiences really helpful in terms of trying to shape the thinking and the work we're doing around this. And this is just the natural next step to that. There are so many benefits to working collectively in this way. There's huge system pressures across the NHS at the moment, and we've heard about them already this morning. They're really real pressures. It's a difficult time to be somebody wanting to access healthcare, to be a patient. It's a difficult time to be working in the healthcare systems because of those pressures. So we need to do things differently, and to do things differently we need to get some headspace. So for me, the main benefits of the collaborative is that it gives us that opportunity to get that headspace, to do that collective thinking. It gives us that opportunity to look at all Wales solutions to some of these huge system pressures, and it gives us the opportunity to share and learn from each other. So those would be the 3 key benefits I would think.